Welcome, everyone. It's so fun to see all across the country. It's great to have you with us for our 2023 healthcare survey titled What the Affluent Think About Giving to Healthcare.
All right, everyone. I know many of you actually, because I see lots of familiar names down there, but I am Kara Wagner. I'm an Associate Vice President on the Philanthropic Council side here at BWF. And for those of you joining us as clients, I know many of you know us very well, but we love giving these webinars to our industry partners across the country, whether you're a client or not. So to those of you who are newer to BWF, we are a national consulting firm. And while Derek and I both specialize exclusively in healthcare and that frontline campaign management, fundraising strategy, all things frontline, we have an entire team of folks behind us that specialize in everything from systems and operations to data science and analytics. We run the gamut. So thank you all for joining us. And I think we're going to have a really great session today.
And hello, everyone. I'm Derek Groves. To those who are familiar with us, it's great to see some friendly names and faces, and welcome to our new friends on the webinar.
Okay, I'm going to kick us off with our agenda. And while we're going to move through these 4 sections, we mostly want you to know that, yes, there'll be time for Q&A at the end.
Just to check to make sure everyone can see introduction and methodology on your screen, we want to share a little bit about an intro to this study for you and also our strategy or rationale for this particular study. So as an intro, healthcare philanthropy really is a unique form of fundraising that's driven by passion and/or energy. And we know that donors in this sector are motivated by likely their firsthand experiences with organizations that they support, or even their loved ones' experiences with these organizations. And our study this year provides perspective on donors' attitudes towards healthcare philanthropy and offers valuable insights into our philanthropic marketplace. So whether you're a team or an individual of one person working in your philanthropy shop, this report will help you navigate the challenges and also press into the opportunities that are ahead for you in our marketplace. And then over the past 23 years, BWF has conducted research to measure the views and beliefs of affluent Americans regarding their charitable decisions and contributions to hospitals and healthcare organizations. These organizations include communities, hospitals, children's hospitals, research centers, academic medical centers, and even long-term care facilities. BWF developed this study as an essential tool for fundraisers to use, and by gathering, analyzing, and sharing this information, healthcare institutions' fundraising programs can better understand the current attitudes towards giving and create stronger and more sustainable, meaningful relationships and programs. Our 2023 study explored the following emerging themes that came about from the study. And you can see on your screen here, we have 1, healthcare as a top philanthropic priority, and a second theme of motivations for donors, a third theme of influence factors, 4th, the patient and family experience, and number 5, my absolute favorite, stewardship. This year's survey delves into the attitudes and actions of donors who responded regarding donating to healthcare organizations in this ever-changing American healthcare environment. So when analyzing the results, we took into account inflation rates, which are currently at a 40-year high. These results emphasize the importance of high-performing development teams to assess and evolve fundraising strategies that inspire giving, while also understanding the possible barriers to philanthropy that include economic factors such as inflation and cost of living. So, Kara, could you share with us a little bit about our methodology that we used? You're on mute. There you go.
You know, somebody had to do it. Somebody had to do it, and of course it would be me. Okay, so as with all studies, the methodology that we apply is really important because we want everyone to understand exactly who we're hearing from. And that's one of the things that makes the BWF study special, is it's really focusing on the criteria that we're looking for in our constituents on a daily basis when we're dealing with healthcare philanthropy. And that is, we wanted to make sure that we were speaking to those who had the means to support with a major gift. So this year's study focused on household income of $250,000 or higher for the household income. So that could be combined or individual. But most importantly, we didn't just focus on capacity. We also focused on those who have actually donated and can really speak from that personal experience. And you'll find as we go through this that we're going to reinforce many of those assumptions that you make every day. But as we work with doctors, faculty members, leaders of our organizations, sometimes assumptions start getting a little messy. In this case, you're going to be able to use many of the data points that we lay out, and you'll be able to use them with those leaders to say, we're not making assumptions. We've heard directly from affluent households who are already donating to healthcare. We have their insights captured right here. And that's one of the things that I really want to underscore, because a lot of what we go through, you're going to go, yeah, of course. Yeah. It's about being able to use this in a data-driven way in your day-to-day lives with those who don't know philanthropy as well as all of you. So with that criteria in mind, it's important that we see that we went to over 14,000 people, but only 734 actually met the criteria of household income and have given a gift. So with that in mind, let's look at what this data really shows us. Important before we dive into what they said, let's talk about who they are, because obviously we know this shapes the way that we may make some assumptions about the data that we're about to see. So it's important to note that males were more predominant than females, and we also had 3% who identified as non-binary. Of that group, we have 78%, so almost 80% were married or in a domestic partnership, which is important because we'll find out later how much those family connections really influence giving. And lastly, you'll see here on the slide of the major categories when it comes to professions. And we really had the most in financial services. Derek, why don't you take us deeper into the actual data and that key takeaways that we saw?
Thanks, Kara. So for our visual friends on the line with us, here's a pie chart for you. And what we know from the study is that for many of the donors that participated, healthcare is a top priority when they're thinking about making their philanthropic donations. And there were 3 top areas of support within this area: healthcare causes, number 1, number 2, hospitals and long-term care facilities, and number 3, human services, such as the Red Cross. And then regarding communications, the donors who took the survey preferred to be contacted electronically or via direct mail. Actually, 37% noted electronic communication as preferred, whereas 26% noted direct mail. And then for giving preferences, donors prefer to donate outright cash, 33% responded in that manner, followed by donor-advised funds, with 25% of the donors noting DAFs. And then finally, multi-year pledges came in at 21 percentile. And then significant influencers included a spouse and partner or family members, with the spouse or partner being the most common or number 1 answer that was given, followed by family members, number 2. And then within an organization, hospital leadership and medical staff, including doctors and nurses, have the most impact on a donor's philanthropic decisions. So giving you some percentiles with that, 38% actually said hospital leadership had an impact on their philanthropic decision-making, and then 30% noted doctors and nurses. And then another emergent theme was the patient and family experience, and that it can play a significant role in philanthropy, as donors may be more likely to give to an organization that positively impacts their life or their loved one's life. And among our respondents, 84% indicated that they had made a gift following a personal experience. And when Karen and I were looking at the initial data, that really jumped out at us as a direct connection between the care that was given and the charitable donation that was made. And then finally, regarding the importance of stewardship, demonstrating the impact of a donor's gift can lead to the future giving and a stronger relationship between the donor and the organization. So we're going to break these down a little more for you and pull out some of the data that really came out or was coded in this healthcare as a top philanthropic priority area. According to our survey results, the most popular sectors for philanthropic donations among our participants were healthcare causes, hospitals, and education. And every survey response came from a donor who donated to one of these sectors, which are widely recognized as some of the most impactful areas of charitable giving. And then over the past 12 months, our survey respondents reported donating less than $1,000 and more than $1 million. So that's a large range that gives you an idea of the total amount of dollars donated by the respondents. And then among our respondents, 78% indicated that healthcare is a significant focus for philanthropic donations by high-income individuals. And again, we define that as households with incomes of $250,000 or more. And then 65% noted that hospitals are a top focus of their charitable giving. So as hospitals continue to play a vital role in our communities, our donors are really recognizing and appreciating their importance. And the data collected showed that all respondents donated within the last year, and this really reflected their commitment and love of their community to give back and pay it forward. Continuing on with our healthcare as a top philanthropic priority, we wanted to highlight for you that the findings suggest that high-income donors strongly prefer healthcare-related organizations and institutions. Our research shows that the most significant healthcare issues that people are willing to support are cancer, mental health, and pediatrics. And you can see with the horizontal bars on your screen that these are the top categories, but there are some other interesting and familiar healthcare philanthropy categories for us. This confirms what we know, but also shows up some new focus areas that many of you are pressing into, such as mental health in your own work, and our donors are also identifying with that. So Kara, could you lead us into a little more about our top healthcare findings?
I absolutely will. I also want to take note that Brad just asked an important question that I think everyone might be interested in. So the question is about when the donors that participated in the survey actually gave a gift. And the important part here is it is within the last 12 months. So we did not do an exact calendar year, anything of the sort. It was, has this been within the last 12 months? So again, please continue to put those questions in the Q&A. That's great. So thank you very much. So Derek also just mentioned, as he broke down those various areas that people are supporting, you will have noted that cancer was the top division right there. When we go into the types of hospitals, you'll see here that it's children's hospitals. And in our industry, we often say that cancer hospitals or divisions are very similar to that of children's hospital. Why? Well, because no one is anti-sick kids and no one is anti-cancer, right? We want to combat these issues. And sometimes digging deeper into other issues is part of the strategy. But it's also important to note that many people give for those really personal reasons. Some give just because they know it is a good resource in our own community. And why am I bringing that up for this slide? It really kind of shows the same thing. So we know that children's hospitals often have that familial connection where they are giving back because of an experience. But often it's because they're a good resource in the community. And even if we do not have children of our own, we want to help others who may. The same goes for our health systems. Often health systems might be located in a city, but they have satellite locations in maybe more rural areas. That access to care, even if you are not the one accessing it, often matters to those who give to healthcare. And of course, we do have the academic medical centers, which play such a vital role in research, that all of these have that component of the personal connection, but we also see them wanting to pay it forward for their own communities as well. You can move on, Derek. So with this, I am actually really curious from all of you, and you can put into the chat. I'm interested if you all felt like 9% when we think about wills and estates. So we've talked about that this is of interest. We know that healthcare donors are interested in healthcare. Shocker, right? But how do they give? And Derek mentioned towards the beginning of, DAFs being a vehicle that we're seeing much more of, but we're also seeing an increase in bequest giving. And it's really interesting to me because I believe 9% of people not having a will at all, and they're donors, and they have a household income of $250,000 or more. I find this to be a low percentage, but it also helps me when I'm guiding for strategy, because we cannot make assumptions. I assume that people have a will and estate. Do I assume they've given to a charity? Maybe not. But if I can get over that first assumption, it opens up a whole new pool of donors to me. And it's very interesting. So our survey found that 9% do not have a will or estate. Well, interestingly enough, Giving USA found a very similar stat. So for those of you who are familiar with that study that comes out annually, you'll see that this is also a holding trend. But look here at the 66% of folks who have a charity named in their will. Again, we're talking only to those who have given to healthcare, and 66% of them have put a healthcare organization into their will or estate. 25% have not listed a charity. Please move on. So of those who have listed, we know that the healthcare causes, number one, at 73%. But you'll also notice hospitals coming in at 60%, and then human services at 47%. What does that tell us? We can start to make those assumptions, but driven by data, that are showing us that personal passion and that commonality. So if I'm giving to healthcare, not only am I giving, I'm actually doubling down. And those are the types of projects, programs, and organizations that I care about. Well, how can we utilize that and leverage it? And really, sometimes it's about knowing, one, do they have a will? Two, what types of programs are they interested in? And how can we connect these dots to leverage it for an even larger estate gift? And speaking to them about maybe some more sophisticated ways and vehicles that land into that legacy giving.
Let's take a look, Kara and friends on the line with us, into the world of donor motivation. So according to our respondents, what motivated them most was when there was a perception of value to their community, first. Second answer was when they believed it was accelerating research. And then third, when they've had a recent personal or family experience. And you can see from some of the other answers, we'll dig into these in just a few slides. There were some other answers that left us curious to learn more, such as a recommendation from a peer and physician request. So Kara noted that some of the data findings might not be too surprising. However, the affinity for their community and the service of the health system or hospital to the community really was the top answer for motivation. Our 2023 study also found that over the last 4 years, requests from physicians and recommendations from peers have increased, while other motivating factors such as a recent personal family experience or the value to hospital and value to the community remained nearly identical. And when we first saw this, we couldn't help but note that this is perhaps the most significant finding of our study. That's my opinion. I'll verify. I'll just kind of give you my opinion here. I had to really step back and think that is quite significant for us, that a request coming from a physician or a peer like a board member or a volunteer in the eyes of our donors was really motivational. And we're going to dig just a little bit deeper for you here, because we want to think about how do events shape philanthropic decisions, or do events shape philanthropic decisions? And our respondents to our survey told us that 58% said that events really do shape their philanthropic decision-making, whereas a small percentage, 7%, said it didn't really have much of an impact on them. So we wanted to highlight this here for you just because many of our clients that we're working with and industry-wide are really considering how to have the highest value from an event. And the voice of the donor is present here, which is the majority are saying that the influence from an event helps them to make a philanthropic decision. Kara, I'd like to learn a little bit about some of the solicitation preferences. So the next slides, could you take us through some of our findings?
Absolutely. And I'm actually going to start more so at the end here, because you just talked about events. And when we think about solicitations, yes, there's fundraising events, but maybe not a direct solicitation at that event. So post-event, how do they want to be solicited? Really important. But in the peer-to-peer category, which is similar to an event, we are seeing a resurgence in peer-to-peer. And much of this is really due to a post-COVID world and that time in which we could not gather 8,000 people together for a run or walk or whatever it may be. And we've also, quite frankly, moved into such a digital world that peer-to-peer can make sense. And it can be done online, it can be done quickly. And with that peer-to-peer, I just want to showcase here, not only do you see it on your screen, but again, back to Giving USA in the 2023 report, peer-to-peer fundraising increased by 58%. And that is 2.2 million attendees in 2021, as compared to 3.4 million in 2022. And the reason I'm really starting with the peer-to-peer is I think it gives a bit of insight into what you're going to see here as the #1 method for solicitation. So hearing directly from our donors, they said, I want to be solicited electronically. I'm going to venture to say that many of you are surprised by that, because how often do we ask for a major gift online? If we peel back and maybe make a little bit of assumptions as we're trying to connect these dots, I think this can still go into that post-COVID, really heavy on the technology. And let's face it, we don't even talk on the phone like we used to. So getting time for meetings, still, all of this is important. But do donors possibly want those proposals delivered to them electronically so they can digest them in their own time? What they think of as a solicitation via email, we know we've met with them over lunch and we've done tours, we've done all of this. They may not even realize that we're soliciting them personally in other ways. But when they think of their own preferences, they want it electronically. And I'm making some assumptions here, because how many of us make a $50,000 gift online? Not a lot, right? But I also think, as we're talking about the solicitation method, let's also look at the ways in which they're making the gift and these gift vehicles. So no surprise, and luckily for us, because we know that cash is king, the outright cash and those outright gifts is still that #1 most common way. But we are seeing such increased sophistication, not only in our own shops, in the ways that we organize our work, but also our donors. They have more choices than ever before. Donors are also seeing themselves in all fashions. They come in all shapes and sizes, and those who can do. But they're also finding new ways to do this. And we mentioned DAFs. So donor advised funds and multi-year pledges, very, very common, becoming even more common. And those donor advised funds, they've been around for a century. They've been around for a really long time, but they've gained much popularity in the last 10 years. And according to our own BWF research and Steve Beaver, who many of you may actually work with here, and Giving USA have found that there are over $250 billion sitting in assets in donor advised funds. Huge number. Here's the difference though. 10 years ago, 15 years ago, when I was a frontline practitioner, if I heard somebody say, oh, I have a donor advised fund, my eyes lit up and I saw little, dollar signs like in the cartoons, because I knew that person was a big philanthropist. Things have changed a bit. Many people have donor advised funds and they are of all shapes and sizes. We have to dig a little bit deeper because all of our donors are seeing themselves have access to new gift vehicles. So with all of that in mind, I think it's also important to note that all donor advised funds are not created equal, and they're also not equally used for the sectors. We have found that actually it's lower in the health sector. And when Derek and I looked at this data, one of the reasons that we are surmising as to explain that is that the healthcare sector needs to move quickly. And sometimes that immediate being able to give that outright cash gift or a larger gift than can come from their donor advised fund, because they want that immediate effect on research, patient care, could be one of those reasons. But overall, what we want you to take away here is that it is just really about knowing the various vehicles and trying to understand what might work better for one donor over another. But I told you that earlier, we saw that there were lower numbers related to the care providers and leaders being that preferred solicitor in the ask, and we went over that. But now we're going to lead you to who influences. And there is a difference between who's influencing the ask and who is making the ask. So a nuance there, but you're going to see quite a difference in those statistics. And it's important that we jump into both the external influences as well as the internal to the organization. So Derek, why don't you lead us through that?
Sure. So the primary factor influencing a donor's decision to give was number one, their spouse or partner, and that was followed by number two, their family. And we know that couples tend to work closely together on making philanthropic or charitable decisions. And we also know that family relationships play a significant role in shaping charitable giving decisions. So for many of you, making sure that the conversation and the story that's being told is really hitting the decision makers equally is very important for the actual solicitation process. And based on our survey responses, we wanted to bring to your attention that hospital leadership, medical staff such as physicians and nurses, board members, volunteers, were all deemed as being influential people to help donors make a philanthropic decision. And from our perspective, this finding was not necessarily surprising for a few different reasons. First, hospital leadership sets the tone in the direction of the organization, which can affect the level of trust and confidence that donors have. And physicians and medical staff inspire donors with their expertise and their dedication to patient care. And then board members and volunteers advocate passionately for the hospitals and health systems that they love and that they've made a priority in their life. And then the majority of our respondents, 67%, reported that a hospital administrator asked them to make a gift, followed by 54% saying physicians. And then after that, 52% noted that it was the development or foundation staff that asked them to make a gift. Our survey also shows that physicians are playing a larger role in motivating donors than ever before. In 2019, the BWF survey respondents indicated that only 13% gave because a physician requested a gift, compared to 2023, which reflected a 21% increase, with 34% of participants stating that they gave due to a physician request.
Derek, I want to actually, I want to interrupt for a moment because I think this is an important thing for us to underscore. I am sure none of you are surprised that hospital leadership or physicians play such a large role in influencing this gift-making decision. It's inherent to us. But this is really where you can use this data when speaking with physicians, especially. I think leaders often get it, the hospital administrators. Physicians really do, value that patient relationship. And because of that patient relationship, we know that there are some physicians who really want to be at the table and are happy to be a partner to you in development. But what about those who aren't? And I know, and again, I have some of my own clients on the call, so I know this resonates with you, where we've got those physicians who go, this isn't for me, this is you, you can go do this. That's great, glad you have confidence in me, but know thyself, right? I will never resonate the same way that the physician who has that relationship. We know that. These are the kind of statistics that I just really encourage you. We'll be sending this out after the webinar. These are the types of real stats that you can show and say, I hear you and I appreciate your trust. And you can see we're still a valued member. We're the facilitators as that development staff. The physician's role, it doesn't have to be a solicitor, but it absolutely plays a vital, vital role in inspiring, because not only are they endorsing you in your ask, but what they're doing is they're talking about their vision for the future of their own program or the overall hospital. And they're saying, I know you trust me, and I wouldn't be talking about this if I didn't trust the person that you're working with from the development staff. So these are the things that we just really want you to encourage to apply in your everyday life. I know it reinforces what you're already thinking, but these are the statistics that can back that up.
So let's look a little more into what we harvested about clinician involvement in philanthropy. 47% responded that physicians giving patient names to hospital fundraising staff and asking the patient's permission was definitely or probably acceptable. And then 9% endorsed referring without permission. 80% reported it acceptable for physicians to talk to patients about donating if patients have brought it up in conversation. And then 14% reported it acceptable when patients have not done so. 10% accepted hospital development staff performing wealth screening using publicly available data to identify patients at larger capacity. And among our respondents, 83% agreed that physicians talking to their patients about donating may interfere with the patient-physician relationship. So while healthcare fundraising depends on wealth screenings and physician partnerships, leaders and staff really need to understand these patient reservations and perceptions to adequately navigate and take the appropriate precautions to reduce any risk associated with perceptions of wealth screenings. Kara, in our data, when we were initially looking at things, you were able to harvest some what we would categorize as women in philanthropy data topics. So share a little bit about what you found with us.
I'm sure no one is surprised that Derek handed over the women in philanthropy slide to me. And I am woman, hear me roar. So quite proud, because you'll note that again, 52% of our participants were male. Yet women are playing a much stronger role in philanthropy than ever before. And what's interesting about this is, and the data has supported for many years, that women are a force behind the scenes when it comes to philanthropy. However, women are now playing a more frontline role. And it is not just from a spouse point of view, it is actually leading that charge. And there's a real significant surge in this. And I can tell you that even so, those of you who are familiar with WealthX, so 90% of ultra high net worth individuals, so that that's usually categorized as 30 million plus for ultra high net worth. So 90% of that group, they're male, right? So we've got a ways to go. So while I'm over here roaring, I'm roaring from the not ultra high net worth income, I can tell you that, but we are slowly getting there. The numbers are shifting. And quite frankly, and I know no one is surprised to hear me say that Mackenzie Scott has played an integral part in this, because she's out front, she's doing philanthropy different than others, and people are following suit. We can use her as that cool kid story for folks of all shapes and sizes. And that equality in giving, it is seen as even more important than ever before, because our demographics are changing as well. So while I know I don't need to tell you this, it is still important for us to engage people, of course, in an equal way. It doesn't matter when it comes to gender, but it can shift your strategic talking points, your messaging, where maybe before it was, should we involve your spouse? Let them guide you on that. There's various ways to look at this, but it's also important because we used to ask women predominantly if their first foray into fundraising, if they wanted to take part in a committee, if they wanted to be part of an event. That's on the menu and it's still important, but it should not be that leading factor. Things are changing. So with that, we know that this is what's happening as we go into gifts. And we've been talking about solicitation and gift vehicle, but it's really important for us to now talk about the insights from this exact group of, but now how do I want to be recognized after I've given a gift? Because we've found how important stewardship is. So let's dive into those numbers. So you'll see here on your screen that we talk about how they want to be recognized. And obviously this all goes under stewardship. And when I think about stewardship, I think of it in about three different, we can cut it even more, but if we think of it in three different categories, we've got namings. Those are easy. If we're naming a building, a lobby, easy, right? Then we have the impact reporting. That, of course, is always going to be our gold standard. We know if we're showcasing how the dollars are used, it inspires further philanthropy. But then there's recognition. Recognition is a wide open field where we have to make a lot of assumptions. We can get creative. The field is wide open when it comes to recognition. But hearing directly from those who are giving, it's interesting to me that, you know, they said their number one choice when being recognized is in hospital admissions. And I'll tell you, this is a shift from previous studies that we've done, and maybe even data that you've seen elsewhere, because really in past years, it was seen as not a necessity to recognize upon hospital admission. Oh, I don't need that. Well, our donors, again, they're becoming even more savvy and they have new expectations. You'll see too that this being recognized in annual reports. I'm sure many of you have even started to get away from annual reports being done in the ways that we used to do them. They're still important to these donors because it's a larger scale, more visible way to showcase their support of an organization. So let's not throw those out. Let's think about new and imaginative ways to incorporate them, but it's still an important part. But then I also want to draw your attention to the concierge services. So this is one of the ways in which they said, I'd like to be recognized as a donor by having access to concierge service. And notice there is a nuanced difference between concierge services and those being recognized via admission. So let's talk about the differences because they often get lumped in together. And concierge services is typically access to maybe specific doctors. Sometimes it's called executive medicine. They can call it many, many different things. You might have different hours in which you can see physicians. You might be able to access them via their cell phone versus the traditional methods. That's more in the concierge services side. However, at admissions, that is more what we consider facilitated services. So upon admissions, you might be directly guided to your appointment by a facilitator. You might have a special area in which you're seated in the waiting room. You may have a blanket put on your bed, a special red blanket that indicates to every nurse coming through, oh, I see that you've supported the hospital. Thank you so much. The important piece here is whether it is upon admission, just facilitated services, or actual access to concierge medicine. The key here is that no one believes that they should be treated differently that has anything related to their actual healthcare. We are not calling them VIPs. All of our patients are important. It is about what is that experience for them in the hospital, and how do we make that a little bit easier by facilitating different services and that enhancement to the experience, not difference in the healthcare that is delivered. So with that, I just want all of you, and again, you can drop it into the chat, or maybe we can talk about it during question and answers. There's also a difference between official concierge medicine, official facilitated admission services, and the unofficial. Sometimes we have full-time employees dedicated, sometimes it's ad hoc. I'd be interested, please jump into the chat if you'd like to say how your hospital may or may not be addressing those. But when we think about this slide that shows how we wish to be recognized, I actually want to go a little bit deeper into that concierge and facilitated services, because while it ranked very highly here, what do they think about it from almost that moral standpoint? Is it actually acceptable to do this, or is it more inappropriate? And you'll see that we get a little bit more mixed here, but that it is still 46% state that it's their number one choice, and they believe that it is acceptable. So we've got 42 who said it is definitely appropriate. A few less said somewhat, and then we get into those that don't feel it is quite as appropriate. And I'll tell you, these numbers are changing every year, and it's because more and more hospitals are instituting these programs, and donors are starting to feel more comfortable with it because they understand it's not about the healthcare that is being delivered, it's the patient experience. And so with that, my question to all of you, and really the way that I would advise that you're applying this data, when you're speaking with those leaders in the hospital who start getting that icky feeling, because that's exactly what it is. I feel icky about treating anybody differently based on how they've supported our hospital. The important part is that more people are expecting it. Once donors become savvy enough, sophisticated enough, and have been exposed to these services, what starts to happen is it becomes an expectation. So at what point will your hospital, if you're not offering these services, will it become something that the donors go, well, wait a minute, at this other hospital, they do this. Why aren't they doing it here? So it's more of a question, but it's also the ways that you can apply it with your everyday leaders as you're considering possible enhancements or implementation of programs like this. Derek, you can move on. So with that, when we think about, we've talked about the in-hospital experience. Well, what happens post-hospital, right? And are they making gifts? Are they being solicited? What happens, right? And you'll see here that of 255 patients, they were not even asked, right? Or I'm sorry, they were asked, excuse me. So of the 255 that were asked, only 71 did not make a gift. But then we have the 344 compared to 22. So the making a gift really does happen regardless of whether you're asking. So that's important. It is happening, but they have to work harder. And you'll see 71 compared to 22. Many more did not make a gift if they weren't asked. Only 22 that were asked didn't make it. That's quite a difference when you look at that. But whether you're asking or not, the donors want to be invited to do that. They want to pay it forward based on those experiences. We have to follow up. We have to ask, because I can guarantee that these 344 that were asked and gave, if they were stewarded correctly, they're going to continue giving. For these 255 that were not, now they have a cold entry to that development team. while you might be stewarding them, you've not made that initial contact that now you're even colder to them. This really makes a big difference. If you don't ask, you don't know. So again, here you'll see 51% of our participants, they were asked. That is an increase. Look, 2019, only 36%. So again, I keep talking about donors being more sophisticated. So are our hospitals, so are our organizations. We all are becoming savvier. We've got the data behind us that shows, again, they want to be invited upon this journey with us. And we know within healthcare, we can't choose when we get sick. We can't choose what happens to us, but we can choose what we do afterwards and how we're going to help that next patient that is about to be diagnosed with something we didn't know we were going to be diagnosed with. So how can we help them the same way that we wish somebody would have helped us prior to our diagnosis? Really important to use with your doctors in helping inspiring them to understand why we do what we do. So with that, let's move on.
So how were our respondents asked to give? 31% of the respondents reported that they were asked through social media outlets. 29% noted the telephone, 26% direct mail solicitations. And our analysis really suggested that donors may be drawn to social media's visibility. And that's probably due to what Kara mentioned about the peer-to-peer fundraising initiatives. But we want to draw your attention to some of the lower percentiles that for us as fundraisers, we really note as being significant to cultivating and soliciting major gifts. And you can see from the vertical bars, this is all kinds of gifts, annual gifts up to principal gifts and above. So I'll highlight for you that 16% noted that a brochure in the discharge packet was how they identified with being asked to give, which is really important, I think, to understand from this survey. And then other respondents, 18% noted that a visit after their stay. So that would be a face-to-face visit. Our survey results indicated that organizations effectively communicate, and the value of stewardship really had a shining moment right here in our survey for us. The impact of the gifts are being communicated to donors. The majority of respondents felt well informed about the impact of their contributions, while only a small percentage said that they felt the communication needed to be improved. This is pretty exciting because most of our clients have top of mind awareness to donor stewardship and very specific stewardship plans. And we wanted to highlight this for you and show you a comparison between 2021 survey and 2022, because you can see extremely well and very well are ticking up, which is a good potential trend for us to see and continue to watch in future years. And continuing with the value of stewardship topic, evidence and analysis of the results indicated that email is the preferred way to receive updates on a gift that a donor has made a charitable gift. So nonprofit organizations should consider email as a source of communication in providing donors with meaningful updates via electronic communications. And then engaging with donors online is essential to communication, fundraising, advocacy, retention, and stewardship strategies for all nonprofits. We believe that American donors are increasingly adopting digital platforms to make donations, and this development should play a significant role in how the donor experience is designed and delivered, especially in an environment where donor retention rates may be declining. Donor expectations in this survey noted that they really understand the impact of their gifts, and this is an expectation going forward as well, and that healthcare philanthropy operations really could be and should be focused on individualized stewardship practices to take these higher scores and really take it to the next level, and make sure that every donor knows the impact that their gift is making, no matter how small or how large. And remember that electronic communication is that preferred method of learning that. So, Kara, let's bring this all together. We want to thank everyone who has been on the line with us and put into action for you some of the best practices that we really see necessary. So here are some concluding thoughts for you.
So what I would like to do, let's leave this up here because I want you all to have a moment to read through this and really look at how we have connected these dots. But knowing that we have about 5 minutes left, what I'd like to do is leave this up for all of you to see. But I want to address some of the questions that I have seen in the chat and the Q&A so that we have just a few moments for those questions. And one of the questions was about the increase in mental health support. And the question is, what do we equate that to? And it's an excellent question because I can tell you, Derek and I, working with healthcare clients across the country, this is something that is by far and away one of the biggest trends that I have seen in the last 2 years. Mental health awareness is at an all-time high, as I'm sure no one is surprised by. So with that awareness, though, is coming not only hospitals are allowed to seek these new programs, increasing beds, but more so than ever before, with the awareness has come the difficult challenges. And we know in philanthropy can fuel change where maybe we're already really good at something and we can elevate it, but philanthropy can also address issues. And the mental health crisis, if there's a crisis in your city, that person may not even have a bed for weeks if it's not addressed. Those problems are now coming to the forefront. Hospitals are addressing them and they're saying, we can't do this without philanthropy. And philanthropists are stepping up. It's at an all-time high. So that is one of the questions in the Q&A. And then also we had the peer-to-peer question. So the question from Brad has been that I noted the increased desire by donors for peer-to-peer fundraising, and if there is a graphic that could be shared that references this. And Brad, I'm thankful that you asked that question because the peer-to-peer has been something that's quite surprising to me because it shot off and then it saw a dip for a few years, and now to see it coming back up. When we share our materials out, I'd be happy to share something that goes along with that. Plus, we also have our full BWF report that has not only the survey results we've shared with you today, but even more, and some graphs that go along with that. So that will be linked in the email that we send out with the slide deck. And then I believe we've got 2 more questions here. One is about the depth of demographics in the survey sample, which is really interesting because, again, we're trying to get it. Who are we talking to on a daily basis in our world, and are these the same folks? So luckily, that will also be in much more detail in the report that we send out because we go pretty deep, that we only shared a few today. So you'll see more of that in the follow-up report. So thank you, Andrew. And then Carl has asked the nuance between support for healthcare and the support of hospitals, and how are those defined and differentiated? Which is a really good question. And I'll say that even in the donor's mind, sometimes there's probably some confusion and crossover because often people don't know what the difference between an academic medical center is and a hospital system. So while there's various definitions and we try to abide by those that are true to the hospital space, with donors, we often use them interchangeably because of their own understanding. So really there, it's important to understand both the actual literal definition and also how donors are defining it. So there is a little bit of gray area there, but that is also defined within the survey results that we'll be sending post-webinar.
And Kara, I do have that here that will be in the report. Healthcare causes, we gave some examples in the final report as cancer research funds and academic medical centers. And then hospitals or long-term care facilities included local hospitals and children's hospitals. And then you'll see human services such as the Red Cross.
Luckily, we are at 1:59 and we have made it through every question that has come through. So thank you so much. I do want to give one moment for Derek. Can you please pull up the survey? We're going to put a QR code. It really helps us to understand if we are hitting all of the high points that you're interested in with these webinars. So your feedback is really important to us. I know that our moderator has put a link in the chat, but you can also click this QR code. Please do fill out the survey so we can deliver more informative webinars for all of you in the future. And really want to just thank you for your time today. We'll be sending this out. It'll include our references because, again, being data-driven and utilizing all of those references is really important to us so that we're not making assumptions and we're pulling from real data that you can actually apply. So with that, lots of follow-up coming your way, but thank you all so much for joining us today. We hope you found it really beneficial.
Thank you.